Up next, we have a question from William with Telemundo Tampa. The World Health Organization said that we can't turn schools into another political football. It's not fair for children. Do you agree with this?
I do, and that's why it's so vitally important that the funds be allocated to help keep our kids safe as they push to get them back to school. It's not simply throw open the schoolhouse doors. You've got to institute protocols and all of the sanitizing requirements. You know that under the CARES Act that was passed by Congress back in March, we provided billions of dollars to states and local communities to institute these protocols. For example, Hillsborough County Public Schools was set to receive about $54 million to help put these kind of protocols and safety measures in place. And here we are in mid-July, and those funds have not been provided to our local school districts. That leaves them hanging on, okay, are we going to be able to afford to spread out the kind of plexiglass, the additional nurses in schools? And you're really leaving them in the lurch. And like I said, I wish that our state officials and the Trump administration had the same zeal for opening schools safely as they do for just plain opening schools. There's a lot that goes into this, but I think it's critically important. It's one of the most important things we can do to ensure kids get back to school. I'm a mom too. My youngest daughter is supposed to go back to college in August, so I can relate. I'm also personally very concerned. How are they going to live together in dormitories and apartment buildings? How are they going to get to class? Are they going to have are they going to use the federal money that we've provided to the state and local communities to institute these safety measures?
Great. And we have a question from William March. Do you see any action Congress could take regarding the planned RNC convention in Jacksonville?
Well, its time is ticking away, and again, the Congress, through the CARES Act and the other emergency aid bills, has provided billions of dollars to do the widespread and rapid testing. We have directed that the president use the Defense Production Act to boost the supply chains. And yet here we are in July, and hospital leaders in the Tampa area are telling me they don't have the supplies that they need to do the kind of rapid testing. Uh, it's very difficult to see how you could have a large convention and still follow the public health experts who are saying do not gather in large crowds. The Democratic convention has been moved to pretty much an all virtual convention. I think that's appropriate. And but here's the message: if President Trump and Governor DeSantis are not going to follow public health experts, it's up to all of us to do it. It's if you care for your neighbors and you don't want to see additional deaths here in the state of Florida, if you don't want to see our mortality rates going up, if you want to have our businesses thrive and get kids back to school, everyone has to become personally responsible for their behavior, and that means the masks, the social distancing, really staying in unless you have to go out. Don't go out into large crowds. It's because we're at such an important inflection point. The need to flatten this curve, especially as the state looks to try to get kids back in school. It's now. It's now that folks have to do everything they can to flatten that curve. Everything that public health experts have told us along the way. We need to get back to the basics and doing all that. And hopefully you all can help convey that message.
Thank you. A reminder, if you have questions, to please submit them via the chat feature. And we have another question from Telemundo Tampa. Do you think that the state of Florida is doing a good job on testing? William shares that there are many reports on duplicating positive tests because of people going back to the same testing site twice, and then it comes out as positive a second time.
No, unfortunately, the state of Florida has not done an adequate job in the testing and tracing. It takes entirely too long to get a test. Heck, a few weeks ago, I felt like I had a sore throat. I called up the county to try to get get a test scheduled. I was cut off in mid-call. I tried one of our local drugstores, never could schedule that test that worked. I have two daughters. They've both gotten tested, but those results took at least 5 days. One had to go to Tallahassee to get tested. Now we're hearing from our hospitals that they have a shortage in testing materials. All of this comes at a time where the Congress has provided states, including the state of Florida, with billions of dollars and direction, the policy direction to the Trump administration to handle the supply chains. In fact, one of the leaders at the Baycare health system told me that they're not getting the help from the state of Florida on the testing supplies that they need. They're having to work their previous suppliers to do it. Again, that we have provided billions of dollars to update our testing and tracing capability here in the state of Florida, and they have failed to do it. They have failed to follow through, and it's to the detriment of all of our neighbors, and that's why, unfortunately, we're seeing the mortality rate inch up. We see the positivity rate inch up, but it's not too late. We're going to be living with COVID for many months, maybe up to a year before a vaccine is approved. So the state has not followed through. They have not done a good job, but it's not too late to turn this around, to institute the kind of public health regime that a large modern state like Florida needs to put in place. We're fortunate here in the Tampa Bay area. We have an outstanding research university that has one of the top public health colleges in the country. We have very strong health systems. We have strong community clinics and community health centers. All of these could be brought to bear if the state and the Trump administrations would help with those supply chains, would help with continue to expand testing and the tracing and isolation piece.
Wonderful. I just submitted to see if anyone has any final questions, but Representative Castor, while we wait, would you like to share about tomorrow's town hall?
Yeah, continuing the theme that it's very important for policymakers to listen to public health experts, I'm going to host a telephone town hall tomorrow afternoon at 4:30 with two leading health experts, doctors, who will be able to answer questions directly from our neighbors across Tampa and Hillsborough County. And that includes members of the press, if you all would like to participate and listen in to the question and answer session. I just think in this day and age where you're getting so much misinformation from the top, from President Trump, you have folks at the Department of Health here at the state of Florida kind of hiding a lot of the important data. It's very important that people hear directly from these public health experts and doctors so that they can make their own decisions to how to keep their families safe.
Wonderful. It looks like that is it on questions. Congresswoman, if you'd like to wrap us up.
Yeah, again, this was intended to be a heart-to-heart, speaking directly to my neighbors across the Tampa Bay area and families across Florida. It's very important that we all act responsibly and listen to the public health experts. We've seen a very serious increase in the positivity rate. Our hospital leaders tell me that they are really being squeezed. There is a nursing shortage, a health worker shortage. And if we do not act responsibly and try to flatten the curve here, the hospitals will become more overwhelmed, and it will be more difficult for the state to handle these new cases of COVID. So I want everyone to be safe, stay as isolated as you possibly can. God bless the health workers and the essential workers who are out there doing their jobs so the rest of us can stay safe. And if anyone needs anything at all, my office team is here to help. Please do not hesitate to reach out along the way. So thanks so much.
Thank you all for joining us. That concludes today's event.
Thank you all.